Welcome. It's wonderful to have you back here, a place where taking care of yourself becomes a pleasure. Tell me, does this sound familiar? Waking up in the morning with a neck that feels stiff as iron, and when you turn your head, a sharp pain shoots through like a needle? Or that nagging, pulling discomfort that follows you all day, making it hard to focus on pleasant things, on your grandchildren, on your favorite hobby? We often blame it on age, on a draft, on an uncomfortable pillow. But have you ever considered that sometimes, just sometimes, this neck pain might be more than just a muscle spasm, perhaps a quiet whisper from our body about something more serious? Yes, today we'll discuss a sensitive but important topic: how certain types of neck pain after age 60 can, in rare cases, be linked to the risk of stroke. Please don't be alarmed. Our goal isn't to scare you, but to arm you with knowledge, because knowledge brings peace of mind and confidence. So, why is the neck so important? Imagine a busy highway along which cars rush in a continuous stream. These are the blood vessels in our neck, carrying vital oxygen and nutrients to our brain, our control center. With age, these roads can wear down. Vessel walls lose elasticity, and sometimes potholes and traffic jams, atherosclerotic plaques, form on them. If such a blockage becomes too large, or if a piece breaks off and travels upward, it can obstruct traffic in one of the brain's vessels. That's a stroke. Sometimes the problem arises from damage to the vessel wall itself in the neck, like a small tear or dissection, which also disrupts blood flow. Certain types of neck pain or discomfort can be an early signal that something is wrong with these highways. One particular sign is especially tricky, often unnoticed or misinterpreted. We will definitely discuss it in detail. I promise that by the end of our conversation, you'll better understand your body's signals, know what to pay attention to, and feel calmer and more confident. No complex medical terms, just clear explanations and real-life examples. Let's figure out together how to distinguish ordinary muscle fatigue from a signal that shouldn't be ignored. Stay with me. This is truly important for your health and longevity. Let's start with perhaps the most dramatic signal our body can send us. This is a sudden, very severe, unbearable neck pain, especially if it strikes like a bolt from the blue and is accompanied by an equally severe headache. This isn't the usual nagging pain you might be accustomed to. It's something entirely different, similar in intensity to a blow. Let me tell you the story of Robert, age 70. Robert had always been an active man, enjoying gardening and tinkering around the house. One afternoon, as he bent down to pick up a watering can, he was pierced by an extremely sharp pain in the back of his head, which instantly spread to his entire neck. He later described it as the worst head and neck pain of my life. At first, he thought he had just turned awkwardly or pulled a muscle. He sat down, tried to rest, even took a pain reliever that usually helped with his back pain. But the pain didn't subside. It was overwhelming. Two feelings battled within him: the reluctance to bother the doctors over nothing, sound familiar, and an instinctive understanding that this was something serious. He remembered his father always saying, "Men don't complain." This mindset prevented him from admitting how bad he truly felt. Fortunately, his wife, Helen, saw his pain-distorted face and insisted on calling an ambulance, and she was absolutely right. At the hospital, it turned out Robert had experienced a small brain hemorrhage, subarachnoid hemorrhage, often linked to a ruptured aneurysm, a weakened section of the vessel wall. Such a thunderclap headache, often radiating to the neck due to irritation of the brain linings by blood, is a classic symptom of this dangerous condition. Imagine a taut string. That's the vessel wall with an aneurysm. At some point, it can't withstand the pressure and snaps like a string. Blood spills where it shouldn't be, causing sharp pain and other symptoms. Thanks to Helen's quick reaction and timely medical help, Robert avoided catastrophic consequences. His case is a stark reminder. Sudden, unusually severe neck and head pain is not something where you should wait and see if it goes away on its own. It's an alarm signal that requires immediate medical attention. Don't ignore these thunderclaps from your body. Better safe than sorry. Listen to yourself. If the pain is truly unlike anything you've experienced before, act immediately. Such sudden, overwhelming pain certainly makes one wary. But the tricky part is that sometimes the signals are much more subtle and easily missed, especially when they don't come alone, but as a cluster. And herein lies the sign that, as experience shows, is most often overlooked. It's the combination of neck pain or discomfort with other seemingly unrelated symptoms: dizziness, vision problems, double vision, blurred vision, loss of visual field, sudden weakness or numbness in an arm or leg, especially on one side, difficulty speaking or swallowing. It's precisely this combination that is often ignored, with each symptom attributed to something different: neck pain, slept wrong, dizziness, blood pressure spike or weather change, vision problems, time to get new glasses. Meet Evelyn, age 66. She started noticing a nagging pain that periodically bothered her on the right side of her neck. Not severe, but persistent. Around the same time, she began having bouts of dizziness, especially with sharp head turns or when getting out of bed. And sometimes, the image in front of her eyes would suddenly double for a few seconds. Evelyn was convinced these were all separate, unrelated issues. "Getting old isn't fun," she'd sigh, brushing off her daughter's concerns. She treated the neck pain with warming ointment, blamed the dizziness on fatigue, and the vision problems on the long overdue need to see an eye doctor. It never occurred to her to connect these three symptoms. She was used to being stoic, not complaining, solving problems herself. The thought that something might be seriously wrong seemed like alarmism to her. The turning point came one morning when, getting out of bed, she staggered badly. The world swam before her eyes, and she almost fell, managing to grab the bedpost. Additionally, she felt a strange numbness in her left arm. The fright was so intense that she finally agreed to see a doctor and tell him about all the symptoms at once. An examination, including an ultrasound of her neck vessels, revealed that Evelyn had signs of vertebrobasilar insufficiency. In simple terms, her vertebral arteries, which run through the channel of the cervical vertebrae and supply important parts of the brain, responsible for balance, vision, coordination, were experiencing blood flow problems, especially with certain head positions. The neck pain was related to problems in the vertebrae themselves, affecting the vessels, while the dizziness, double vision, and numbness were direct consequences of insufficient blood supply to the brain. Imagine a stream feeding a mill. If the stream partially dries up or its channel is blocked by stones, problems with vessels or vertebrae, the mill, brain, starts working erratically. Evelyn sought help just in time. She was prescribed treatment and special exercises, which significantly improved her condition and possibly prevented a full-blown stroke. So, there it is, the most frequently missed signal. Pay attention not only to the neck pain itself, but also to what's happening to you at the same time. Dizziness, vision problems, sudden weakness, numbness, difficulty speaking, combined with neck pain or discomfort, are very strong reasons not to delay a visit to the doctor. Don't analyze your symptoms separately, like puzzle pieces from different boxes. Look at the whole picture. Your body is trying to tell you something. Learn to listen to it. Learning to listen to your body is truly important, especially when it concerns not just the combination of symptoms, but also when they appear. Another crucial aspect to note is neck pain that clearly worsens or appears with specific head movements, especially turning or tilting the head back. We're not talking about slight discomfort from sitting in one position for too long. We're talking about a clear connection. Turn your head a certain way. Pain, dizziness, or even vision darkening occurs. Let's recall the story of George, a 75-year-old car enthusiast. He noticed that every time he needed to look back over his shoulder to reverse out of a parking spot, not only did his neck hurt sharply, but his vision would momentarily darken, and he'd feel slightly faint. Initially, he attributed it to his cervical osteochondrosis, diagnosed many years ago. Well, there go the joints acting up again, he thought, trying to turn his head less and relying more on mirrors. He even started avoiding situations requiring sharp head turns. It seemed like just an age-related, inevitable decline. He was used to tolerating discomfort from arthritis in his knees and applied this habit to his neck, not wanting to seem like a weakling or a hypochondriac. One day, sharply turning his head at the sound of a passing car, he felt such severe dizziness that he had to lean against a wall to keep from falling. This genuinely scared him. He finally went to the doctor. After examination, it turned out that George, besides osteochondrosis, had a peculiarity in the structure of his neck vessels, vertebral arteries, and changes in his vertebrae, which caused the artery to be partially compressed during certain head turns. Imagine a garden hose. If you kink it, the water pressure drops sharply. The same thing was happening to the blood flow to George's brain at certain moments. This condition is called vertebral artery syndrome, and, while not always leading to stroke, is definitely a risk factor, as the brain periodically experiences oxygen deprivation. George was given a set of exercises to strengthen his neck muscles, taught to avoid provoking movements, and prescribed medication to improve circulation. He not only got rid of the frightening symptoms, but also felt more confident driving and in daily life. What can we conclude? If your neck pain or associated symptoms, dizziness, vision darkening, are clearly linked to specific head movements, don't ignore it. This could be a signal of problems with blood supply to the brain, caused either by the condition of the vessels or by changes in the cervical spine affecting these vessels. Be sure to tell your doctor about this pattern. Perhaps simple lifestyle changes or special exercises can help you avoid serious problems. Don't put up with discomfort that prevents you from living fully. And if pain associated with certain movements can develop gradually, sometimes a specific event triggers problems. The next scenario requiring no less vigilance is the appearance of neck pain after any kind of trauma, even if it seems minor to you. This could be a fall, a sharp jolt of the head, e.g., during sudden braking and transport, or even just an awkward turn in your sleep that caused a clicking sensation in the neck. Listen to the story of Barbara, age 69. She stumbled slightly on the stairs at home. She didn't fall, but swayed significantly and jerked her head sharply to keep her balance. It seemed like nothing serious, just a slight scare. But the next day, one side of her neck started aching. The pain wasn't very severe, more dull and nagging. Barbara decided she had simply pulled a muscle. It'll go away on its own, she thought, applied a familiar ointment to her neck, and tried to forget about it. She always prided herself on her independence and disliked consulting doctors for what seemed like trivial matters. A week passed, then another, and her neck still ached. Moreover, it started to seem like her cheek on the same side was slightly numb, and sometimes she heard a strange noise, tinnitus, in her ear. She attributed this to fatigue and lack of sleep. Fortunately, her daughter, visiting her, noticed that her mother was tilting her head strangely and often rubbing her neck. Learning about the fall and the persistent pain, she persuaded Barbara to get checked out, and it was just in time. Diagnostics revealed Barbara had a small dissection, tear, of the carotid artery wall. This means the inner layer of the vessel wall had torn slightly, likely during the sharp head movement when she stumbled. Blood began to collect between the wall layers, narrowing the artery's lumen, opening, and creating a risk of clot formation, which could travel to the brain and cause a stroke. Imagine a pipe where the inner lining has separated from the wall. The water flow is disrupted, and a blockage can form there. Barbara's symptoms, neck pain, facial numbness, ringing in the ear, were signs of this problem. She was immediately prescribed special treatment to prevent clot formation. The moral of this story is, don't underestimate neck injuries, even seemingly minor ones. If, after a fall, blow, sharp movement, or even an unexplained click, you develop neck pain that doesn't resolve within a few days or is accompanied by other unusual symptoms, headache, numbness of the face or limbs, ringing in the ears, vision problems, be sure to consult a doctor. This could be a sign of vessel damage requiring timely treatment to prevent a stroke. Remember, your body isn't a fortress. Sometimes even a small impact can have consequences. Be mindful of yourself after any incidents. Being mindful of yourself is important not only after injuries, but also when the body signals a problem through entirely different, sometimes very alarming symptoms. There's another combination that can confuse anyone: severe neck stiffness, rigidity, making it difficult or impossible to tilt your head forward, touch your chin to your chest, combined with a high fever and severe headache. Such a condition often makes one think of meningitis, inflammation of the brain linings, which itself is very serious and requires immediate medical attention. However, it's important to know that similar symptoms can sometimes arise in other conditions, including those potentially linked to stroke risk or stroke itself, especially if caused by infection or vessel inflammation, vasculitis. Here's the story of David, 71. One morning, he woke up with terrible stiffness in his neck. He couldn't turn his head without pain, and tilting it forward was practically impossible. Simultaneously, he had a severe headache, and his temperature rose to 38.5 degrees, 101.3 degrees. His first thought was, flu or a cold, and I must have strained my neck too. David belonged to the generation accustomed to riding out illnesses at home with tea and honey. He decided to rest it off, take a fever reducer, and wait. He didn't want to go to the hospital, fearing long waits and possible admission. He thought he had just caught a virus. But by evening, his condition worsened. The headache became unbearable. He developed sensitivity to light, photophobia, and some confusion. He started talking incoherently. His son, who came to visit, immediately called an ambulance. At the hospital, doctors first suspected meningitis, but after tests, including a lumbar puncture, this diagnosis was not confirmed. However, further investigations showed signs of significant inflammation in the body and some changes on the brain MRI that could indicate vascular problems secondary to this inflammation. It turned out David had a serious systemic infection that caused such a strong reaction in his body and posed a threat to cerebral circulation, blood flow to the brain. Imagine a fire alarm going off in your house, high fever, headache, neck stiffness. The cause might be a small fire in the kitchen, meningitis, or it could be problems with the electrical wiring throughout the house, systemic infection, vasculitis, which is also extremely dangerous. The main lesson here is the combination of severe neck stiffness, high fever, and headache is always a red flag requiring immediate medical attention. Don't try to self-diagnose or self-medicate. Even if it's not meningitis or a stroke per se, it could be another serious condition requiring urgent help. It's crucial to quickly determine the cause and start the correct treatment. Don't risk your health by trying to tough out such alarming symptoms. Your well-being is the priority. And of course, speaking of all these warning signs, we must mention a situation familiar to many of you. I understand some might be thinking, but what if my neck hurts almost constantly due to arthritis or osteochondrosis? How can I recognize danger then? This is a really important question. Let's address those of you already living with chronic neck pain caused, for example, by arthritis, osteochondrosis, or a herniated disc. In this case, it can be particularly difficult to recognize new, potentially dangerous signals because you're used to a certain level of discomfort. Well, it hurts, same as usual, you might think. Let me tell you about Susan, age 73. She had suffered from cervical osteochondrosis for many years. Neck pain was her almost constant companion, sometimes worse, sometimes better. She learned to live with it, doing special exercises, using ointments, occasionally taking painkillers. She was so used to this pain that she stopped paying close attention to it, considering it just part of her normal. She felt she knew her pain inside and out. Internally, she had resigned herself to the fact that aches and pains increase with age and tried not to focus on them. One day, she noticed the nature of the pain changed slightly. A sort of pulsating sensation was added to the usual aching feeling, and the pain started radiating more often into her shoulder and arm, causing tingling in her fingers. Additionally, she had a sensation of slight numbness on her tongue a couple of times. At first, Susan thought it was just a flare-up of her osteochondrosis due to the change in weather. She increased her painkiller dosage and carried on as usual, but her intuition told her something was off. The pain felt familiar, yet different. She hesitated for a long time, not wanting to seem like an alarmist to the doctor, but finally decided to seek a consultation. And it was a good thing she did. The examination showed that Susan indeed had a flare-up of osteochondrosis, but more importantly, the changes in her spine were beginning to affect the nerve roots, hence the arm pain and tingling. However, the pulsating pain and tongue numbness prompted the doctor to order further testing of her neck vessels, which revealed moderate carotid artery stenosis, narrowing, requiring monitoring and preventive treatment. Her chronic pain, like background noise, had almost drowned out the new important signals. Imagine living near a railway and being used to the noise of trains. But if one day you hear not the usual horn, but the sound of screeching metal, that's a reason to be alert, even amidst the usual noise. What's the takeaway? If you have chronic neck pain, be especially attentive to any changes in its character, intensity, or location. Don't automatically attribute everything to your usual condition. Pay attention to new accompanying symptoms, even if they seem minor. It's crucial to know your normal, to notice deviations from it promptly. Regular checkups with your doctor, and honestly reporting all changes in your well-being, can help ensure nothing important is missed. Your vigilance and knowledge of your own body are your best allies in maintaining health. So, We've discussed several important points regarding neck pain after 60. I sincerely hope this information hasn't frightened you, but instead has given you more understanding and confidence. Please remember, far from all neck pain is a harbinger of stroke. In most cases, it really is muscle tension, osteochondrosis, or simply fatigue. But knowing about those rare but important red flags we talked about today, that's your strength. It's the ability to notice the signal your body is sending in time and seek help promptly. You've lived long, full lives, accumulated wisdom, and invaluable experience. You deserve to feel well, enjoy every day, connect with loved ones, engage in your favorite activities. Your health is your treasure, and caring for it isn't selfishness, but an expression of self-love and respect for your life. Don't be afraid to listen to yourself. Don't hesitate to consult doctors if something worries you. You have every right to attention and care. Believe in yourselves, be attentive to yourselves, and may each of your days be filled with ease and well-being. Take care of yourselves.